Greetings all and welcome to the AERN webinar on higher education and COVID-19 in the context of in Africa. Today we will have three panelists, Dr. David Adewuyi from Virginia Union University, is a professor there. And we have Dr. Lucky Odirile, a professor from the University of Botswana, and also a visiting professor at Ohio University. And the third panelist is Dr. Kwabena Ofori-Atta, a professor at Central State University. Before I begin, I would like to stress that this webinar is organized by the African Educational Research Network, and which was funded in 1992 by a group of US and African universities. And at the risk of being corrected, because we have some of the funding members in the panel, I think that meeting took place at Clark Atlanta University in Georgia. Yes. And Ohio University was a funding member. The purpose of AERN is really to disseminate information about and scholarship about Africa and also the African diaspora. And based on the history that is written about AERN, the first chair or the first executive director of AERN was Dr. Shelby Lewis from Atlanta Clark University. And the main initiator of AERN was Dr. Charles Peng, who was the 18th president of Ohio University, who unfortunately passed away during last summer. And some of the founding members of AERN are Clark Atlanta University, Ohio University, Kenyatta University, National University of Lesotho, University of Manchester, University of Ottawa, Oklahoma State University. And I have to share that AERN, being 29 years old now, will be 30 years old next year. So we will be celebrating the 30th anniversary of AERN. So in that event, we will have a tribute to Dr. Charles Peng. AERN also has the African Symposium Journal, which is a peer-reviewed journal that focuses on research related to Africa in any discipline. So it's a multidisciplinary journal as long as the topic relates to Africa. And as I mentioned earlier, 2022, we'll have the summit for AERN, and we'll celebrate the 30th anniversary. So stay tuned for more information about the summit and the 30th celebration of AERN. So with that, I will stop sharing to start with our first presenter, who is Dr. David, Dr. Kwabena Ofori-Atta, who is a professor at Central State University. Dr. Kwabena Ofori-Atta completed his doctoral studies here at Ohio University in curriculum and instruction with an emphasis in elementary education. He has 2 master's degrees, one in public administration and the other one in international affairs. His research interests include gender studies, higher education, international education, comparative education, multicultural education, educational technology, teacher education and Middle Eastern Studies. And he has published a book titled Going to School in the Middle East and North Africa. And Dr. Ofori Atta has also published many articles in referred journals and in Encyclopedia of Education and several book chapters. So I have the pleasure, the privilege really to introduce Dr. Ofori Atta, who will be presenting about higher education in Africa. If you bear with me, um, I think Dr. Atta share his PowerPoint with us, so I will try to uh, share his PowerPoint on the screen. Dr. Atta, I will be sharing your PowerPoint for you, so you will let me know when to move to the next slide. So,
Okay, sure.
and please let me know if you can see
I
my
can see it on
screen.
my screen.
Okay,
Yeah,
if you can
it
see
is
it on your
visible.
screen. And there you go.
Good. Thank you. And good afternoon to my colleagues and all those online spending their time with us. In fact, as the organizer said, AERN has become one of the perhaps oldest African educational institutions in the US. And we have been working very hard to bring research scholars in Africa to share their ideas with us through our online journal, the African Symposium. Now, today at this webinar, we are going to share our research findings on how higher education institutions in Africa are responding to the COVID-19 pandemic. By the end of our presentation, you will realize that African higher education institutions are not just sleeping. They are doing something like what we are all doing here. Now, for our presentation, we'll start with a prologue, then talk briefly about the onset of the pandemic and the reaction of some of the activities the institutions did, the impact on research, impact on international education, and when Africans saw all these things, what did they do? We talk about the innovations in teaching and learning, cooperating with international agencies, and then we also talk briefly about the current situation in Africa, and we touch on the summary and conclusion. And we've also added some references to help those of you who would like to read more about the impact of COVID-19 in Africa. Next slide. In the African higher education context, it is difficult to imagine public universities facing a more intense set of challenges than what they are experiencing because of COVID-19. Now, I made this assertion because currently, perhaps all African higher education institutions have problems with resources such as funding, personnel, and so forth. So when the COVID-19 brought its problems, many African or perhaps all African universities were least prepared to deal with it.
Mhm.
And so it added to the burden that was already there. Now, when COVID-19 started in spring of 20, public universities in Africa closed, while some private universities, like many universities globally, switched to online learning. Now, as you will find out from the presentation, perhaps all African institutions of higher learning are using online learning at this time. Next slide, please. The onset of school closings affected all sectors of education system in Africa and the rest of the world. Now, according to UNESCO study in 2020, all countries closed the elementary and higher education institutions for a while. In Ghana, schools closed for 57 weeks. Nigeria closed for 25 weeks. Burkina Faso, 16 weeks. Zimbabwe, 44 weeks. Now, all these figures are approximations. Okay, next slide. Now, in Europe and the America, the story remains the same. USA closed schools for 62 weeks. Canada, 51 weeks. Germany, 38 weeks. The United Kingdom, 27 weeks. Asia was not spared the ordeal of school closings. China closed schools for 27 weeks. India closed for 73 weeks. Pakistan, 60 weeks. And the Philippines, 52 weeks. Now you will see that the Asia, they have highest numbers of school closings. And perhaps that can be a subject for another research. Next slide, please. The number of impact on research. Now remember, our group has its goal of conducting research. And when the COVID struck, we were pulled down. The number of research license applications in some institutions, I got a few from Kenya, that decreased by 8.2% 2019 to the 2020. According to Kenya National Bureau of Statistics Economic Survey, a survey of 2021 released in 2020. Now, many scholars abandoned their research work in the field because of curfews and restrictions placed on researchers. Consequently, publication process of number of journal papers or research reports slowed down considerably during the peak of the pandemic, when the pandemic dwindled. Now, at the University of Science and Technology in Ghana, one professor lamented that because of the COVID, all their publications, everything stopped because they had to abandon campus and people were not even getting back the paper they had sent for reviewers. So its impact was really, really devastating. Next slide, please. The response of African impact on research, the response of African governments and higher education institutions to the pandemic was to close many institutions, as already pointed out. The closure meant disruption in learning, teaching, research, and scholarship. As Mutapo has argued, postdoctoral research fellows or postdocs make a valuable contribution to research outputs on higher education institutions, produce new knowledge using innovative techniques, and generate much needed research. Now, he made this observation from South Africa. Impact on international education. Now, international education is also one of the areas that suffered the most.
Mhm.
You remember, all of us here came here on international education track. Now, according to NAFSA, currently more than 5 million students per year study outside their home countries. But there is a great concern for the future as the worldwide COVID-19 crisis is having a dramatic impact on international education. When the crisis broke, over 1 million international students were studying in the United States alone, making intellectual and cultural contributions. In the 2018-2019 academic year, they contributed over $41 billion to the US economy and supported 458,000 jobs. Now, sometimes many people think that international students come here only to make use of American resources. We also give them money and jobs in some respects. Now, many African students aspiring to study abroad had to abandon their ambitions because of the pandemic. American, Asian, and European governments closed their borders to international travels. The ongoing crisis has also raised questions about the future for many in education abroad fields, such as whether to conduct their summer and fall programs. Now, you remember almost, I don't know, but many US institutions has summer programs in Africa and elsewhere. And so with the COVID still in place, I don't know how these institutions are going to handle it. Considerably fewer students are expected to travel abroad this year, which will create financial hardship for some offices, institutions, and companies, many of which are funded by the fees paid by participants. Next, please. For more than 70 years, the number of students from abroad at US colleges and universities have been steadily rising from about 25,000 students in 1948-49 to more than 1 million in recent years. With border closings, flight cancellations, and numerous other challenges to global mobility in the 2021 academic year, the number of international students dropped 15% from the previous year to about 914,000. That number includes students taking online classes from US schools, whether on campus or from overseas. The drop was driven by fewer first-time students coming from abroad. The number of new international students fell more than 45% from the 2019-2020 school year to the next. Next slide, please. But other data published by the International Education IER Institute of International Education paint a more hopeful picture. That is the good news about it. Institutions responding to IIE's snapshot survey reported that new international student enrollment rose sharply in the fall of 2021. At our place, yeah, we had about a few students coming from abroad, but we expect them to follow what we call the COVID protocols. Now, still, any rebound in international student enrollment is likely to be uneven, varying by academic program, host university, and sending country. It is important to realize that time and space will not permit me to go into breakdown of figures for international students by continents or countries. Now, those interested can maybe David can share, but the open doors can give you the figures.
Yeah.
Yeah. Although many African students who could not travel abroad to further their education had deferred enrollment, many could not pursue their dream of traveling abroad because of complications from the pandemic. In Africa, and in the case of higher education, the crisis hit universities, both public and private, particularly hard because already they had nothing in place to bring in new technology and so forth. Many universities in Africa suffer from limited digital infrastructure, capacity, and connectivity, which made the transition to online learning even more difficult.
Mm-hmm.
In the African higher education context, it is difficult to imagine public universities facing a more intense set of challenges than what they are experiencing because of COVID-19 pandemic. When the COVID started in the public universities in Africa closed, while some private universities. Now, I am making this assertion because I don't think that the universities took anything into consideration. No one even knew what was going on. No one knew the strain. No one knew how the disease was transmitted. So to be on the safer side, all they did was to close and then allow the universities to the students to live. Now, advances in technology have enabled students and professors in Africa and elsewhere to continue working and learning despite the challenges posed by COVID-19. Although many universities in Africa suffer from limited digital infrastructure, capacity, and connectivity, which made the transition to online learning more difficult. It is through technology platforms such as Zoom, Skype, Google Meet, Microsoft 365, WebEx, Teams, and so forth have made it possible for universities and organizations throughout the world to not only reduce costs associated with the delivery of training, but also to increase the effectiveness of the learning environment and help improve learning, teaching functions, especially for adult learners in colleges and universities. Now, during my time of interviewing some of students in Ghana, they told me what they use is Zoom. I spoke to them about Teams, and they didn't know what it was. But I said, okay, even if you don't know Teams and you use Zoom, that's fine. Many African universities have joined international communities to use some of the above tools to offer quality education to students on limited basis because of lack of resources to compete with institutions in the developed countries. Next slide, please. Digital learning can help open up access, serve learners better, and make higher education more resilient. And in Ghana, Kenya, and Nigeria, many faculty members are quietly innovating, often below the radar of their institutions and their colleagues, and frequently unsupported. Now, if you read more about it, you realize that some faculty in Africa, these are just a few of the countries, are coming out with new tools of teaching and learning. However, their efforts are not recognized, and I don't even know why. Now, focusing our efforts on three countries, Ghana, Kenya, and Nigeria, and through a rapid dive below the surface, we uncovered many accounts of academics creating their own content, repurposing, purposing, and adapting materials produced by others, and using the tools at hand to assemble a digital learning infrastructure to reach and support their students. According to Kigoto, an ambitious action plan has been proposed to the continent to connect African universities and other post-secondary education institutions on the continent to high-speed internet at a cost of what? $52 billion. This proposal was made by the World Bank, and a spend that will also provide laptops to 15 million students and 500,000 teaching staff in the next 5 years, running between 2021 and 2025. And I was happy to come across this. And again, I do not know when this is going to start, but I think if you read current efforts by African governments to help our students learn, you know that they are serious about it. The World Bank is also serious about it. Please, next slide. The World Bank and Knowledge Consulting Limited, which proposed the intervention, said the suggested cost will also cover bills for upgrading campus networks, bandwidth costs for upstreams connectivity, and development support for national research and education networks and their regional counterparts, such as the Ubuntu Net Alliance, West and Central African Research and Education Network, or WACREN, and the Arab States Research. And I don't know whether we will qualify to dip into this proposal, but the action plan is included in a study, feasibility study to connect all African higher education institutions to high-speed internet. And in the 4 case studies that were undertaken in Burkina Faso, Cote d'Ivoire, Mozambique, and Uganda. So you see, they're also taking studies in another other countries. Now, as the COVID Education Alliance, this is also a new international institution that has come into. They call it COVIDIA. The COVID Education Alliance is also a new institution that has come into existence. Its main goal is to help institutions worldwide to overcome their problems, to overcome the problems handed over to them by the COVID-19. It has permeated aspect of every human life. And so this institution has come to stay. I think it came into existence in just 2020. It hasn't gone far, it hasn't done much, but I think it has come to stay. Next slide, please. My conversations and interviews with several African professors and students indicate all university and college or higher education institutions in Africa have gone back to campus. Faculty and students are learning both online and the face-to-face models. Most of them just use emails. They attach the assignment to their professors. Some of them don't have the luxury of using learning management systems as we do here. Many professors use email and text messages to get students instructions and learning materials. Faculty record lectures for students who could not join live discussions because of poor internet connectivity or for other reasons. Students and faculty observe what has now become a popular jargon, COVID protocols on campus and in the classroom. Now, some of the students I interviewed told me at all strategic locations on their campus, they have places they wash and sanitize their hands. And on campus, they are all expected to wear masks like we do here. And they try to follow the 6 feet spacing where possible. They eat at the cafeteria and they try to space out as we do here. Now, the summary and conclusion, COVID-19 pandemic has exacerbated the already difficult situation facing many postdocs and their research activities or learning in general. The institutions closed as a result of reduced funding, challenges with travel and mobility due to immigration regulations, limitations around conducting research during the lockdown, and reduced prospects of contract renewals for those unable to meet project targets for which they were funded, resulting in significant loss of important career development opportunities and trajectories. The demand for study abroad is becoming stronger as COVID-19 appears to wane. References here are numerous, and please try to get copies of the University of World News Africa edition. And sometimes they devote a whole session to the impact of COVID-19 on higher education in Africa. Thank you.
Thank you very much, Dr. Kwabena Ofori Ata,
Thank you. You're welcome.
for your wonderful presentation. And now we are going to switch to Dr. David Adewuye. And I couldn't be uh, more happy to introduce Dr. David Adewuye for several reasons. One is a very energetic person, but yes, but he's a professor of English education at Virginia Union University, a former dean of the School of Education at Virginia Union University. Uh, he is the founding and director of the Center for International Studies at Virginia Union University. These are not the reason that I'm excited to introduce him. The reason that I'm excited to introduce him is because he's the one that I replaced as chair of AERN and also the editor of the journal, The African Symposium. So you understand that I'm very pleased that I can have you here And with no further ado, Dr. David Adewoye.
Thank you so much. First, for your efforts in putting this together. And to my colleagues, I'm happy we have been together for a very long time. I took over from Oforiata and Emmanuel took over from me, so it's a long journey. And Lucky has been there for a long time. I remember we went to Botswana. She was our host then. And since then, we have been doing this. Now, let me say this. AERN has done a lot for African scholars, especially in the area of publication. Many of those who published in the African Symposium have had the opportunity of tenure and promotion as well. So let's congratulate ourselves that we have been doing a very great job for our people in Africa. All protocols observed. My topic is teaching and learning in Africa during COVID-19. My presentation might not be as optimistic as Dr. Oforiata's presentation because I want to concentrate on the major problems facing teaching and learning in Africa. In trying to research this topic, I came across one report by the Human Rights Watch. What this body did was to make 57 remote interviews with students, parents, teachers, and education officers in 9 African countries. I will start from the end. The summary of the major findings of that report shows that school closures, which Dr. Oforiata delved into, caused the pandemic that exacerbated previously existing inequalities, and that students who were already most at risk of being excluded from quality education have been mostly affected. It's like saying the same thing Dr. Oforiata have dealt with in another language. I will now highlight different areas of problems associated with teaching and learning in African countries. 1, we have students who do not even receive any education during the pandemic. Because of school closures, many students received no education after schools are closed across the continent in the year 2020. Students did not receive any teaching. Students, most of them, received no instruction, no feedback, or no interaction with their teachers. Remember, as already pointed out, the pandemic hit the whole world, and the world was unprepared. So that is a big problem with Africa, which have been associated with poverty, lack of resources, and inequality in what we have taken for granted in developed countries. Because of the pandemic, just like Dr. Oforiatta pointed out, African countries did not fold their arms. They resorted to distance education or online education. But we know, because of our situation, African students were learning less through distance education. Students frequently studied fewer topics or less content through online education. And a more serious problem that resulted from the pandemic was mental health consequences. Many students shared feelings of stress, anxiety, isolation, and depression, which they linked to the lack of contact with their school community. It is during the pandemic that we know the importance of a community called the school. Discussing with friends, meeting with your teachers, and so on and so forth. That community was lost. And people were not adjusting well to that lack of community. And that is causing a lot of mental health issues. Again, another problem with pandemic in Africa is the fact that education is not free. Many parents are burdened by costs associated with trying to continue educating their children during school closures. I think you can imagine what I'm trying to explain here. Before the school closure, the parents know that their wards are in school. Once you pay the school fees, that's it for the term or for the session. But during the pandemic, those schools closed, and the parents want their children to continue to have education. That is another cost, whether they like it or not. So that poses a big problem for them. In all of this, our female students are disproportionately negatively affected by the pandemic. One, even the fear of sexual molestation, if the only choice is to visit a teacher at home. Boys can easily visit teachers at home, but not the female students. And in a situation where they cannot do that, in order not to be idle, they often take on childcare responsibilities and do a lot of household chores at home because the schools are closed. So our female students, we have to look after their siblings, wash plates, cook, and so on and so forth. This is a big negative impact of the pandemic on African countries. When children or our students need to use technology to study, and we know for sure that access to devices or data is in very short supply, students often end up getting unequal access to the resources. That's a big problem in Africa. Before I leave the issue of female students, many of them have the problem of increased risks of child marriage. When I say child marriage, I'm not talking about 15, 16, even at the college level, at the university level, when schools are closed and female students are idle, we know what might happen. They might just end up getting pregnant, even if unplanned. Okay, another big problem caused by the pandemic is even at the level where we say we want to use Zoom or other resources for connecting African universities. The digital divide is a big problem. There are limited access to technologies, just as Dr. Foriata pointed out as well. In very rural areas of Africa, there is lack of access to radios, televisions, computers, the internet, and data. And this has left many students unable to engage in remote learning. Even when you know what to do, you don't have the resources. That is the big problem with COVID-19 pandemic in Africa. Again, because the pandemic hit Africa and the whole world unprepared, digital literacy was also absent at that point in 2020. So digital literacy, both for students and their teachers, were lacking at the beginning, although they are trying to catch up now. And we know that digital literacy is now increasingly recognized as an indispensable element of global education. So in order to have right to education, the digital divide must be bridged. Another problem posed by the pandemic in Africa is intergenerational education inequalities. When the schools are closed, the parents might go to their own work, and our students are left with caregivers. And caregivers with very little to low levels of formal education have greater difficulty to support students at home when they engage in online education. And I think I made it earlier that children living in rural areas are even more hit negatively by the pandemic. In rural areas, there may be no resources to adapt and implement measures to continue education during school closures. Not only that, we have students with disabilities. All factors affecting children's education during the COVID-19 pandemic become more magnified for students with disabilities. I think that is self-explaining. Then we have students living in extreme poverty. And you know, in Africa, that is our own signature. That's what they assign to us. Africa is the most poverty-stricken continent of the world. Now, I know this very well because I'm from Nigeria. I was in Nigeria in September. And a country like Nigeria that is affected by armed conflicts and insecurity, kidnappings, all this exacerbate the problem of pandemic in Africa. It is not only Nigeria. I learned that Ethiopia is in problem now. Sudan is in problem. I think there are many other African countries that are insecure, and there's a continuous armed conflict. So in such a situation, you cannot think about education. And again, with poverty comes along students who have to work to pay for their fees. I don't know whether to call that one child labor or not, but in most cases, many students have to work to pay for their own education. Those are the few highlights of problems associated with the pandemic in Africa. I have some suggested solutions. One, African governments should prepare to get students back to school now that COVID-19 is waning. But they must do that with careful public health planning in line with WHO guidance to prevent and control further spread. And finally, before schools physically reopen, those offering remote learning should track those students who participate and reach out to those not participating and try to help them re-engage in their education. Thank you for listening.
Thank you very much, Dr. Adewoye. And just for uh, to remind you, Dr. Kwabena talked about higher education, scholarship, and international education in Africa during COVID-19. Dr. David Adewoye just talked about some issues related to teaching and learning. And we saved the best for the last. So I'm talking about Dr. Lucky Odirile, and will be our next presenter. Dr. Lucky is a Robert and Willie Glyden visiting professor here at Ohio University. She is a graduate from the counseling and higher education program here at Ohio University as well, and also a graduate from the University of Botswana. In 2020, after COVID-19 was declared a global pandemic, Dr. Lucky was appointed to lead the University of Botswana psychosocial and mental health team, which work with both the Ministry of Health and the Ministry of Local Government to attend to the nation's frontliners' mental health and psychosocial needs. As I mentioned earlier, she returns here to Ohio University as the Robert and Gliding visiting professor. Uh, uh, and she is an outstanding scholar who has had significant impact in education at large. And amongst some of her many recognitions include being the recipient of the Counselor Education George Hill HIV and AIDS Champion as well as Trendsetter Awards. Dr. Lucky is the University of Botswana Director of Career and Counseling Center, where she oversees 3 units: counseling, careers, and job placement. And also, she has served in the University of Botswana Council of a body which oversees the overall administration of the university. And she also serves on 2 national boards in Botswana. And this morning, I was very pleased to see her most recent award as the recipient of the alumni of the Global Engagement Alumni at Ohio University. So Here at Ohio University, Dr. Lucky is working with Professor Mona Robinson and other units in the Patton College of Education, where she is co-teaching graduate courses, legal and ethical aspect of counseling and mental health consultation and dissertation preparation. So it is my pleasure to introduce Dr. Odile Lucky. And contrary to the other presenters, we will go through a Q&A session. And Dr. Lucky, thank you very much for having you and for uh, responding to our invitation. So I will open the floor for you to ask you. The first question is, how has COVID-19 affected higher education in Botswana? Thank you again. You are muted, so let's see. Good, yeah.
Thank you very much, Jean. Thank you very much to the previous speakers who have really addressed the challenges faced by Africa. I just want to start by saying, when you spoke a lot about the changes in education that are continuing to be different and the problems deeper, I think he can be called a prophetic researcher who saw what was going to happen post COVID-19 or during COVID-19. And I also want to state that I had an opportunity to look at the different researchers, few researchers who have addressed the challenges, and want to recommend the research stories from IRB members and Zebino, as well as Salino et al., as other researchers have said. And I'm going to share with you, try to answer the questions as somebody who was the coordinator and the leader of the Ministry of Local Government and Rural Development and Ministry of Health and University of Botswana coordinator. I was right in the middle of COVID and had the opportunity to listen to different stories through debriefing sessions and through talking to the community, as well as through listening to what was happening in the entire continent through webinar stories as they were shared. So yes, COVID-19 extraordinarily affected Botswana, and it interrupted learning, as Dr. Dave had said already. There was extreme shift from what we are used to, from the norm. Students were forced to go home. And in the case of the University of Botswana, it was very interesting because before the first state lockdown, the university was already on short vacation. And you know what short vacation means. It simply means the student had left temporarily to come back on campus, and they had left a lot of their belongings as well as study materials, because everyone who takes a break wants to take a break from everything. So when the lockdown was announced, students were really stranded. They were worried, they had fear, they had extreme fear of the unknown, because they didn't know. They had heard about COVID from television, from the media, how it was killing a lot of people around the world, especially China. So learning was interrupted. Students went back home. Dr. Dave has and Dr. Atta have touched on how we face different challenges at home when we talk about students being sent back home, so unprepared. Nobody ever anticipated such a great shift. And every time I talk about the COVID-19 shift, I think of how in 2018, somebody invited me to talk about marriage and family shift. And when I talk about such things, I normally want to search my heart and hear what it says so that before I read what other researchers have written, I can speak with the people what I have learned. But that topic took me such a long time to find what was in my heart on the shift. Little did I know that I was going to spend the next few years talking about the extreme shift that happened in education because of COVID-19. Anyway, kindly note that when we say learning was interrupted, we mean in different ways at different levels. Africans are social people. We are presence people. We believe in talking, exchanging greetings, finding out how beautiful the sun is and how our parents are doing at home. So when the extreme shift from the norm to virtual learning and virtual strategies was introduced, there was great confusion. We felt that something was taken away from us and it wasn't fun. So learning, which is one of the things that we have hope in as Africans. When I was growing up, my mother told me daily, make sure that you go to school. Make sure that you learn the foreign language. Make sure that you work for yourself. Make sure that you represent your country. So when something like this affects our main core of life, which is education, you can never, ever, if you are not an African, measure the extreme of uncertainty that we were going through. And both the speakers talked about the uneven access. Even when schools went back, there was just too much chaos. First, let me talk about the fact that our classrooms are huge. They are built in such a way that we have large numbers of students, 101, 102, 80 students at a go. And you can imagine the emptiness of the universities as we were moving around without these students. How we felt, those of us who have been teachers all our lives. And when we talk about uneven access, we mean there was lack of power, there was absence, there was power cuts, there was unreliable network, and all kinds of things. There were no computers, and there were phones, few phones for students, and some of the phones were not even smartphones. So I want you to think deeply and really internalize what we are talking about when we say learning was extremely interrupted. And this new introduction of a new shift of moving from the person to virtual was such a strange phenomenon for Africans, let alone the being locked and being at home, from day to day without going to the cattle post, without going to the farms, without going to the funerals, without going to the weddings, which are our social activities. Our lives greatly changed. And I wish that the people who had invited me to talk about shift in marriages can invite me now, because I really understand a shift that I have never seen. I've been invited quite a number of times to teach the impact of HIV and AIDS on education and development in Africa. Man, I never imagined that Africa would again go through what it is going through right now. Compromised learning, compromised continuation, completion, graduation. Everything was greatly affected. Disrupted schedules. You see, with us, schedules are important to us because we have time to go to school and time to go to our families and time to go to the farm and time to go for social gatherings. And all these things make us a people, make us who we are. The previous presenters have talked about huge financial constraints. As somebody who was coordinating the mental health and the psychosocial team, I have never seen so much confusion. It was like every cent that was there was channeled to how do we save the lives of people? What do we do? Every cent. And when we talk about money in Africa, you must know that we already don't have enough. So if the little that we have is channeled to something that was unexpected, obviously that's a big challenge right there. And COVID-19 affected higher education also by breeding psychosocial and mental health challenges. I'm a counselor, and I've listened to the most painful stories that I've never heard even during the time of HIV and AIDS. I look at the trail of orphans that COVID-19 is breeding in Africa. And we have talked about the trail of orphans during AIDS. You know, I get emotional when I talk about these tropical diseases because I just feel that whatever we try to put in place in Africa, whatever we try to improve, whatever we try, to try and match or at least be like other people in certain ways, something just comes all of a sudden and takes it away from us. I'm talking about the grief that the teachers, both the teachers and the students, went through. You can't be in that classroom when your students' parents are dead. You can't be in the classroom and try to do any visual learning when somebody has lost an aunt and an uncle and a mother and a father. The fear that gripped the students as to the uncertainty of tomorrow was just too much. Will there be a 2021, 2022, 2023? Are we going to be still alive? And if we are still going to be alive, how is life going to be? When we talk about grief, in Botswana at one point, because of social distancing and because of fear of the spread of the disease, people were not allowed to attend funerals. If you are an African and I'm saying this, you know what that means. Prolonged grief, lack of closure. How can my mother be put in a grave when I'm not there? That's unheard of. It has a lot to do with my future and also my survival. But that's what happened during COVID-19. And of course, Dr. Atta mentioned something on increased research challenges due to limited or lack of access to people and organizations. And lack of research because of untimely deaths that were just unbearable. Why would you be going from people to people asking them questions and trying to research when people are hurting and they are not even certain about anything concerning their future? Dr. Dave talked about there was no teaching at all, there was no education at all. I want to close answering this question: how has COVID-19 affected higher education in Africa and especially in Botswana, by saying, when Yoko talked about the problems of education becoming deeper and more complicated, he was just too prophetic. I'm an educationist. I look back, but as somebody who is a counselor, I cry a lot when I read the stories that I hear every day. And Dr. Dave, I don't know. I don't understand I just hope that you great researchers will continue to answer the questions that Africans have. Thank you.
Okay.
Thank you very much, Dr. Loki. And for those of you who are attending, if you have questions for any of the speakers, you can put the questions in the chat, and I will try to go to as many as time allows. So, Dr. Loki, you just talk about some of the mental health challenges that both students and faculty have experienced, or maybe they are still experiencing in Botswana and probably in most other African countries. So now, uh, given your expertise in counseling, so what are the resources and support that are available currently at the University of Botswana for not only students, but also faculty who have to deal with these issues? And if you are aware of support and resources in Africa or the African countries, you can speak to that as well.
The committee that the Ministry of Health and local government requested the University of Botswana to have was mainly to assist the frontliners with psychosocial and mental health issues, as well as legislature. The University of Botswana has a counseling center that has quite a good number of counselors, and they attended to such issues. But of course, the problem with COVID is everything is like a drop in the ocean because the numbers are extreme. So all the helping professionals, which means the counselors, the social workers, and those in health and wellness, were able and they continue to give as much assistance as possible. But one of the things that are very crucial about COVID is the importance of collaboration, teamwork. We can't fight this as individuals. The organizations in the country that offer counseling, they joined hands to try the little they could do. The churches, the chiefs, and we kind of reached out to our traditional way of doing things as well. The importance of uncles assisting as much as possible. But some of the ways that will be helpful right now when we look at the extreme mental health challenges, and of course, like Dr. Dave says, the exacerbation of those that were already on the ground. I mean, it's all extreme. It is very important that Africa looks more into the helping profession, expanding counseling, recruiting more counselors, but of course, utilizing the kinship networks that we've always had, you know, of the pastors, the churches, the chiefs, the advisors, anybody who could assist in any way they can. And just to know that right now, it's a matter of saving lives. Like, for example, when we talk about grief, as soon as I entered Ohio University, I talked to the program coordinator of Counselor Ed that one of the most important components that have to be added to a lot of counseling programs is grief and trauma.
Yeah, thank you very much for that. There is another, since we are talking about COVID-19, and recently I have conversations with several friends from various African countries, and they were mentioning the issue of people who do not believe that COVID-19 is a thing, or even if the vaccine were to be available, so they don't want to take it, etc. How much is that an issue for educational institutions, or did somebody misinform me?
With Botswana, Dr. Ima, there was no need for anybody to be convinced or, it was very clear because people just started dying. Teachers specifically, outstanding people. I mean, we lost the chancellor of the University of Botswana. We've lost professors. We lost outstanding people. So we've never had to deal with convincing anyone that COVID was real, it was alive, it was killing people. No, we didn't have any issue. We were instead struggling with what do we do to save the few people that we have. As you are all aware, we are one of the smallest countries in the entire Africa.
Thank you very much. And again, I would say if you are participating and you have a question for one of the speakers, please feel free to put it in the chat. And I believe that they will be more than happy to ask your question, to answer your questions.
Jane,
Dr.
before they ask, there's a part that Dave and Atta and maybe me have not mentioned of the fact that when the virtual learning was introduced, we had to deal with the struggles of educating, training. We are not like you here. A lot of people don't use computers in their teaching. A lot of people don't use Blackboard and Moodle. So that in itself also affected the budget. Training. How do we get people to understand what is expected of them? That was a big challenge. It continues to be a big challenge right now because it's not only the students and the teachers, it's also the administrators now, because everything seems to be, everything is going to, right now we are speaking as we are because everything is virtual.
Yeah. Emmanuel.
Yes.
I think I mentioned that in my presentation, that apart from lack of those resources, even those who have, they have to be trained and retrained on how to use those resources. But that's not what Lucky said something that struck me hard, and that is the fact that in Botswana, nobody needs to campaign that COVID-19 exists. It's the exact opposite in Nigeria, where I come from. Anytime I was talking to my people in my hometown, Ilarogo in Nigeria, Southwest, he said, no, we don't have any COVID here. We are just hugging ourselves, we are eating, we are dying together. So until people were being carried from Lagos back to the village, and they now said they were victims of COVID-19, that's when they started paying attention. But even up to today, it is not as if it really affected them that much. They just go about doing things and anyhow, they don't care.
So now, yes, that's what I was told, and I think that Botswana is a very good exception. I think that other countries can learn from that. Even here in the state, some people are still in that belief that COVID-19 is not a thing. But
Mm.
now, knowing what you know now, all three of you have uh, talked about the issues that uh, COVID-19 revealed. It's not like they were necessarily created by COVID-19. They were there, but there was no need to pay attention to them because uh, people could cope with whatever was available. So now COVID-19 showed you what happened, what the situation is. So what are some preparedness strategies that you think can be adopted? I know, Dr. David, you talk about some, but I think Dr. Kwabena and Lucky, what are some COVID-19, post-COVID-19 preparedness strategies that you think can be adopted now, looking forward?
Many universities, I mean, at least in Southern Africa, the ones that I've interacted with, don't talk that much about risk management, a budget for risk management. But I think one thing that COVID-19 has taught us is that we always have to have budget for the unknown because we don't know what tomorrow holds. And not only universities, but even the governments have to have some kind of votes and for risk management. The other thing, for my profession, counseling, COVID-19 has shown the world that counseling is crucial. That more counselors have to be trained. That the psychosocial and mental health of a human being is crucial. And right now, it's important to expand counseling centers. It's also very important to train more counselors. But I don't know how many universities are seeing that need. A lot of people are still like, this thing will come and it will go. But the challenges and issues of people are just, they can't be measured. I mean, if, for example, right now, you look at how many of the students are on the ground and are learning, how many are not because they have issues of having lost everybody, so they cannot cope. And those whose parents were the breadwinners, as Dr. Dave mentioned, now they can't go to school. There's a lot that universities and higher education have to look into, and the governments, as to if this goes on, what are we going to do? And then if something like this hits in the next 5 or 10 years or 100 years, whatever, what are we going to do? Preparation for an unknown future.
Thank you.
Good.
Dr. Kwabena.
Yes. Now, thank you very much. During my research, I came across somebody's research stated that 80% of the people in Africa have COVID, but they are not aware.
Mm.
I said, well, if I add this to my load, I might be moving into other people's area. So why don't I leave it as it is? Now, as David said, when I went to Ghana, people insisted on attending funerals. I told them, even when I lost my own brother, I said, bury him as soon as, oh, no, 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 bruh, you are abroad, you don't know this, you know this. Hey, do you want to kill yourself? I said, no. And they ignored me, put the body in the morgue for about 3 more months, did everything, even though the government had banned funerals. Again, what we must do going forward is that we have to know that technology has come to stay. Many African countries, government do not pay attention to making investments in education. Now, if you go to Ghana, we have about 50 universities. Their aim, to me, is to make profit. So these institutions They don't have the resources to invest in technology. And so it's going to make it hard. Again, the time has come for parents, teachers, and others to learn how to use technology. If you go to many African countries, the only access students have is for their cell phone. They want to do everything on their cell phone. And cell phones may not be compatible with some of the servers we have. Now, I went to Ghana in July. I went with my laptop and I bought data, very, very expensive. So what I want to do is the government, all governments in Africa should either waive taxes on tools that are meant for learning, because we can get a lot of revenue if students, teachers, and research scholars are enabled to use technology to do their work. You don't travel. If you look at the meeting we are having here, previously, all of us would have traveled to OU to sit down. And do you know how much expensive that would have been? So once again, um, some of you have talked about death, loss of job, and so forth. But the fact of the matter is that if you paid attention to the presentation, the World Bank has a program to give about $52 billion to help technology in Africa, higher education institutions. But the question is, how are we going to utilize this? Most of the time, we use the word corruption, corruption, corruption to cover everything. We have to be sure that the money is real. We have to be sure we have rebuilt infrastructure. The time has come that we must rise up. Now, when I interviewed people, they are essentially following what we are doing in the US, in Ghana, or in Africa. The US is still the leader in fighting COVID-19. Africa can fight COVID-19 from also a different angle. Remember, I think one African, is it Malaysia? No, Malagasy, or said they had found COVID drink and so forth. And later on, it found out to be what, false. So no matter what we do at this stage, we cannot go on. We have to work together as a team. Look at my presentation, how this affected international travel, international students, scholars who are going on sabbatical leave, everybody. Now, even you don't know, as Lucky said, whether you be the next person to be buried. The COVID does not discriminate. So right now, that's why I'm doing this presentation from home, because I didn't want to be wearing mask and so forth. So I told my dean I want to stay home, finish, and then come to school with my mask on, like a duck, you know. So we.
This is mandatory for us here.
Oh no, you don't look like a duck. No, you are wearing it well. You know? Now, so what we have to do is that, as Lucky said, we have to set up what we call contingent fund for the unknown. We should never be taken by a second surprise. Who knows what is going to happen again? I can never imagine that there will be something that will cripple the whole world. It started gradually in China. We were all making fun of it. We saw the Chinese eating all these strange dishes, and now look at what they brought the world. So we have to be prepared. We have to be prepared. And even if we can set up Ministry of the Unknown, that will be good. So again, we have to be on the alert. Technology is the way out. Let us advise our governments to invest in it, and everything will be fine.
Yeah, thank you very much, Dr. Kwabena. And Dr. Lucky, there is a question that is directed to you specifically. It is, how can life education organizations and employees prepare for future crises like the COVID-19?
And that's exactly what Dr. Atta has been trying to say. But I just want to add the importance of technology structure, not only in, starting from primary school, from elementary, students have to be exposed to the use of computer, because whether we like it or we don't, this seems to be the norm and may be the norm for a while. So I think Dr. Atta answered it very well.
Mm.
Well, thank you very much. And so it's about 1:30, and I think Dr. David, I want to be accommodating. I don't see any um, other questions in the chat, but it looks like yes, we have one more question coming. Is what specific approaches might you recommend that we at U.S. universities can do to eliminate the great needs that exist at universities in Africa? So, how can you? Uh, yes. So what is possible in that area? What specific approaches that you recommend so that here in the U.S. in U.S. universities, so that we can understand the needs that exist at universities in Africa?
I think one of the ways is international collaboration is extraordinarily helpful. For example, I have you know a COIL partner, and through that, US was able to appreciate our challenges, and we were able to appreciate their blessings as well as the few challenges they have. But that is one of the ways, and doing research together to find out as much as possible the different gaps and different loopholes and how we can try to address them. One of the greatest needs, if I've said this to Dave many times, if each of the Africans who is at an American university can advocate for one scholarship for an African graduate, um, that's always a great help, because whatever I learn from here, I'm able to take it home and help others. But even if I don't go, like Dave and Atta, those who have stayed here, there are other great help initiatives that one does at home that make a great big change in education.
Yes.
Well, now, as you just said, this forum is a great example for what we can show our people back home, how they should prepare for the unknown, or how they should deal with the current situation. As we've observed, when you go to any African, even look at what these people are doing in Sudan, Ethiopia, fighting. When you have COVID around your neck, you're already dying, and still you want to shoot one another. What is the sense behind this? So we have to be sure, we have to be very careful that we know that COVID-19 is real. And even a leader helping you might lose his life in the process. So it is something that we have to educate our people. Sometimes now you can pick up a phone, have a video chat with people at home. And that's what I do. And when I went home, I educated my people. When any people who came to my house, I always had a mask on, and somebody said, "Oh, take it off." It's a long time since I saw. I want to see your face. Okay, you can see my face, but space out.
That's it.
So
Move
yeah,
back.
step back, and you see. So the important thing for us to do is that we have to help them, because all nations are looking to the US. And if you are here, why don't you share the trick or the secret with your people? They don't care. They don't care. And now, if your child asks you money to buy for laptop, please don't refuse. If they ask you money for cell phone, please don't refuse. Because, or even they need money to buy extra gadgets. I know before I went to Ghana, I sent them several things for the students to connect online and so forth. And after everything else, they said, "Oh, grandpa, daddy, The data is this. Then I said, okay, how much do you need? So they are very happy. And I
Yeah.
told them, I am sending you this because here I still teach, but always from home. So I want you to connect and learn online. Don't take things for granted, you know. So we must constantly remind our people, remind our professors. I have some colleagues teaching in Africa. I interact with them. Even before I did this presentation, I interviewed all of them, sat down, and they said, oh, but why do you worry about this? You see the question they asked me? Why do you worry about this? It's your headache, it's your problem, not ours. If you're afraid, why not you come home? In Africa, we are safe.
You
But I am
see?
telling you, we don't know the effects of the COVID. Sometimes even a pain in your finger could be the result of the COVID. It can do many, it can damage you in several ways.
Yeah.
That's why I say Africa, 80% of people don't even know they have it.
Exactly.
So again, go ahead.
Ghana and Nigeria is almost the same thing. Everything you are saying happened when I was in Nigeria in September.
Yeah.
I spent 10 days in Nigeria and I was teaching my courses here from Nigeria. So if you have the money, there are resources there, but it is expensive.
Mm-hmm.
It is not just for an ordinary person. You must be prepared, you must have the money, and you know how to go about it. So probably those of us who are here, let me use Nigeria as an example. One single dollar, $1 is 570 naira.
I don't believe it.
$1, 570.
Hi.
So if I have $100 that I want to help somebody with in Nigeria, that one will be dancing all over the place.
Hmm.
We can do that. We can support them financially,
Mm-hmm.
but we must be sure that what we invest in is what we have in mind. They
Yes.
get the money, they go and marry another wife.
Okay, I want to add to what Dave and Atta have said, the importance of motivation.
Yes.
Yeah.
When we were coiling with Dr. Robinson, one of the things that my students appreciated a lot was how much they were motivated to
Motivated.
realize that students were responsible for their own learning,
Yes.
and how they stayed on task
Yes.
to make sure that they completed their assignments
Mhm.
and that they did whatever was expected of them.
Yes.
So motivation is
Yes.
very helpful.
Let me speak to that. I have a foundation in Nigeria, in my hometown. Once you get my scholarship, you must show the results of the semester before you get the money for the next semester.
Mm-hmm.
So that is an encouragement and innovation to make sure. You see, this money, I'm sweating to get the money. But when I give you, you must work for it.
Good.
That's a way to make them responsible. That's what I do.
Yes, there is another question for you. It's a genuine question out of ignorance. So, are you aware of any effort currently uh, underway in any African country from an epidemiological perspective to develop a vaccine? Because all of the vaccines that are available now, they developed in China, in Russia, in the US, and not in any African countries. And I know that in Nigeria, in South Africa, just to name these two countries, there are great um, universities. So what is being done in terms of research so that you don't have to rely on a country as 200 million people receiving 500,000 vaccines, that is a drop in the bucket. Are you aware of any research, even if they are not completed yet, that are underway?
I'm not aware of any because one would have thought Nigeria and South Africa would be the first to jump in and try something. But I also am aware that we are used to clinical trials and a lot of things are associated with vaccines. So we talked about the problem of financial constraints in Africa, and that could be one of them. That could definitely be one of them. I think right now what has been happening with a lot of governments is trying the best we can to save lives with what we have.
Well, at the Kwame Nkrumah University of Science and Technology, they started making some efforts. But you see, the situation is so critical that nobody has got the time to wait for experiment. If it's available elsewhere, why don't we use it? I think they are still working on it. And the problem they have, you rightly pointed out the financial constraint. Research is not cheap, very, very expensive. Sometimes people have to sleep at the lab in order to keep their eyes on development. So Ghana, we are working on it, but we are not going to tell the world because it's tricky. It's very, very tricky. We don't want to be jokers.
David, how about Nigeria? Are you aware of anything?
I know for sure there might be some, the first generation universities, they won't be keeping quiet, but just like Kwabena said, they will keep it to themselves until they can get a result, something to show.
Yeah.
Yeah.
All right. So I think it's we normally we had anticipated to have the forum, the webinar on for an hour and a half, even though we have scheduled 2 hours. So we are 1 hour 45 minutes now. I would like to thank those of you who took your time to attend. And I wanted to remind you that this is an event organized by the African Educational Research Network. And our purpose is exactly what we are doing here, is to disseminate information and scholarship, increase awareness about Africa, the African continent, and the African diaspora. I would like to thank also Dr. David Adewoye, Dr. Odirile Loki, Dr. Kwabena Oforiata for your time and your very and sharing very insightful information with us. So with that, I will say.
I think Lucky has an answer.
Well, I just wanted to announce that tomorrow, same time, 12 to 1, I'll be talking about a similar topics, the responses of Botswana, and I'll be sharing the stories of COVID-19.
Okay.
12
Yes,
to
thank you very
12
much.
to
So
1.
if you, those of you who are in the attendance, if you can attend, and I think that Dr. Lucky will be very appreciative of that. It is a pleasure to have all of you here, and on behalf of AERN, thank you very much. I hope that you enjoy the rest of your day.
Excellent job, Emmanuel.
Sorry?
Thank you.
Yeah,
More
thank
of
you
this,
very much.
please.
Yes,
More
Okay.
of
that
this. We need to
concludes.
help our people back
All
home.
right.
Yeah.
Bye now.
Thank you.
Bye-bye.
Okay.
Bye-bye.
Bye.